You guys already know what the deal is. You guys already know what we're going to be doing today. We're doing NCLEX questions. Make sure you guys like the stream, you guys follow, and you guys share. I need 100 people in here, and I need 1,000 likes. But here we go. Question number 1. The nurse witnesses the collapse of a child while at a sporting event. The child is not breathing and has a pulse of 50 per minute. The nurse calls the emergency services and initiates rescue breathing. After 2 minutes of rescue breaths, the child is still not breathing and is pale with a pulse of 30 beats per minute. All right, so which of the following actions should the nurse take next? Is it initiate chest compressions, provide rescue breaths for an additional 2 minutes, perform abdominal thrusts, or use a finger to check the mouth for a blockage? What are we thinking? And the answer is number 1. All right. Initiate chest compressions. All right. So infants and children often develop respiratory distress and bradycardia prior to cardiac arrest. After witnessing the collapse of a child who is not breathing but has a pulse, the nurse should contact emergency services and begin rescue breathing. Rescue breathing is performed at a rate of 1 breath every 2 to 3 seconds. If the pulse remains less than or equal to 60 beats per minute, and there are signs of poor perfusion, aka skin pallor, then the nurse should initiate chest compressions and reassess the pulse every 2 minutes. Question number 2, the nurse is making room assignments for multiple clients. Which of the following semi-private room assignments would be appropriate? So I want you guys to tell me where this falls under when it comes to the client needs. All right, I want you to tell me where it falls under. So is it a client with gastroenteritis and a client with chemotherapy-induced nausea and vomiting, a client who had a bowel resection 1 day ago and a client with asthma exacerbation, a client who had a total hip arthroplasty 2 days ago and a client with asthma, or is it a client with an iron deficiency anemia and a client with intractable diarrhea? Which one are we thinking? And the answer is number 2. Number 2, when making room assignments, it is important to remember that a client with an active or suspected infection should not be paired with a client who had a fresh surgical wound or is immunocompromised. A client having an asthma exacerbation does not have an infection and is not at risk of spreading infection to a client who had recent bowel resection surgery. Here we go. Question number 3. The nurse is talking with a client with major depressive disorder. Which of the following statements by the client would best indicate that the client is not currently at risk for suicide? So which one? The key word is not at risk. Currently, okay? Number 1, I've lost my imiperamine prescription and I need a refill. I plan to attend my grandchild's graduation next month. I will sign a no suicide contract at today's appointment. I seem to have a lot more energy since I started therapy. What are we thinking? But the answer is number 2. Clients receiving treatment for depression and suicidal ideations must be carefully monitored for indications of increased suicidal intent. During a client interview, the nurse should assess for psychiatric medications, availability of help during a crisis, future goals and plans, home and work environment risks, overall effect and level of energy, and possible access to weapons. Clients who articulate long-term personal goals and family milestones are less likely to attempt death by suicide. Question number 4. The nurse is caring for a client who had a myocardial infarction 2 days ago. Which of the following actions would be a priority for the nurse to take? All right, and I'm going to show you guys what it looks like. All right. And it looks like this. It looks like this. I think everybody can see that. If not, I can blow it up, make it a little bit larger so everybody can see it. All right. So these are the labs that were given to us, right? So here are normal labs over here towards the left. And then over here on the right are the labs of the patient that had the MI 2 days ago. All right. So let's see. Are they normal? Are they abnormal? Right? And then down here, this is what the patient's ECG or EKG display looks like. And of course, look, this is where I got it. I said I got it from UWorld, right? No gatekeeping. I'll tell you where I got it from because Why not? Because questions are all out there. Okay. Everybody's talking about that potassium because that potassium 3.5 to 5.0 and it's at 3.0. So we know that's out of range. Magnesium looks good, right? Creatinine looks good and sodium also looks good. All right. So now we can go back to the question. So now what priority should the nurse take based off of the lab values that we have? Administer potassium, administer amiodarone. Do I want to notify the provider or apply cardiac defibrillator pads? What are we thinking? And the answer is number one, right? Number one, which was administer potassium. Okay, so in ventricular trigeminy, premature ventricular contractions occur every third beat. Myocardial injury predisposes the client to ectopy, which increases the client's risk for lethal dysrhythmias. PVCs are caused and or exacerbated by hypoxia, electrolyte imbalances, emotional distress, stimulants, fever, and exercise. This client's morning laboratory results show hypokalemia, which is low potassium, right? Therefore, the priority is treatment of the underlying cause of the ectopy by administering the prescribed potassium replacement. Question number 5. The nurse is caring for a client who has a do not attempt resuscitation directive, DNAR or DNR, whichever one you see, right? The client experiences cardiac arrest and the client's children or adult child states, please do whatever you can to save my patient or save my parent, sorry. Which of the following actions should the nurse take? Is it contact the healthcare provider to confirm the DNAR directive, activate the emergency response team and initiate CPR, request the presence of the client's healthcare proxy, or is it explain the DNAR directive to the client's child? What are we thinking? And the answer is number 4. Advanced directives outline the client's choice for medical care ahead of time. This allows the family and care team to follow the client's wishes at the end of life when the client may be unable to make choices known. Clients can create a do not attempt resuscitation directive instructing that CPR and other life-saving measures be withheld.